Hello, dear students. Welcome back in a part 2 of drug dependence and drug abuse. I am Ranjeet Ade, lecturer Geeta Devi Khandelwani of Pharmacy, Akola. The learning objectives of our today's topics are: at the end of this topic you are able to describe the sign and symptoms and treatment for the opiates, alcohols, abuse patients, then difference between the drug addiction and drug habituation, and you were able to identify the commonly abused drugs or the compounds. In earlier part we was discussed the definition of drug dependence, drug habituation, drug addiction, drug abuse, drug hallucinogen, and drug tolerance. Then after that was discussed the general sign and symptoms of drug abuse patients, then criteria for the drug abused, and how the drug abuse can be takes place. These things was discussed in the last part. So in this part we'll start again with the abuse of opiates or the opoids. The classes of drug are commonly used by the addict person. Heroin and brown sugar are the choice of drugs. A dose of 25 mg of heroin effect lasts for about 4 hours. So repeated administration is needed to avoid the psychological and physical discomfort. Dear friends, see that most of the opiates or opioids, this is the type of drug addiction. There is a difference between the drug addiction and the habituation. These opiates or opioids produce the physical dependence and in some kind of psychological dependence. You can say this can opiates or opioids can produce both the effects, physical as well as psychological, but mainly this is act over the physical dependence. Okay, the examples of these opiates or opioids are codeine, fentanyl, hydrocodone, methadone, morphine, oxycodone, oxymorphone, and tapentadol. Then examples see here on the screen: opium, heroin, morphine, oxycodone, hydrocodone, codeine, etc. Then abuse of opiates. What are the medical complications? Which syndromes are produced in the drug opiate abuse patients? It can produce the constipation, excitement, drowsiness, swelling of hands and feet, pinpoint pupil, impotence in a male, low libido. There is a chances of hepatitis and AIDS due to the use of contaminated needles. So these are the general symptoms result from the abuse of opiates. These medical complications are produced those people who are abused with opiates. Then withdrawal symptoms. So first step of our treatment is drug withdrawal. Then in then after the withdrawing these drugs, these are produce some withdrawal symptoms. So after 8 hours, means take stop to taking these drugs, within 8 hours it produces the anxiety, sweating, and patient may be crying, and they are craving to take this drug or the compound. After 20 hours, chills and panicness can be found in the patient. Patient get panic to get this drug, and sometimes this patient is maybe dangerous, or and he's perform various activities to get this drug. Then after 24 to 48 hours, after stop to taking this drug, it can produce the nausea, vomiting, diarrhea, hypertension, and may leads to the fever. Up to 1 week, severe muscle cramps are occurred within the patient, and week to month, insomnia and anxiety may cause to the patient. So these are some of the withdrawal symptoms of the opiates, because patient is get physically and psychologically depend upon this drug. So this is the drug dependence. Then pharmacological approach for the treatment of the drug opiate abuse patient. Pharmacological approach: a narcotic antagonist like a naltrexone is given, nalorphine are given. It blocks the naloxone, nalorphine, naltrexone. These are the antagonists are used for the treatment of opiates. It blocks the action of opiates as they are resemble in a structure with the opiates, so they are bind with the receptor and replace these opiates or narcotic drugs from the receptor sites, and because of that their effect can be reduced. A substance substitute like a methadone at a dose of 30 mg in divided dose is given for initial 3 days. Then psychological approach: apart from the drug treatment, moral and social counseling is desirable in such a condition. We have to motivate this patient, we have to rehabilitate and provide a social and moral support to the patient for their recovery from this condition. So let's see the difference between the psychological and physical dependence. Psychological dependence is also called as drug habituation, and physical dependence is also called as drug addiction. Okay, and this difference is very important for the annual exam, or as far as annual exam is concerned. So first of all, we see the difference between the psychological drug dependence and physical drug dependence. Psychological drug dependence is also called as drug habituation. Physical drug dependence is also called as the drug addiction. Question can be asked: give the difference between the psychological drug dependence or the physical drug dependence and physical drug dependence. Or question can be asked: give the difference between drug addiction or the drug habituation. That kind of question can be asked in the annual exam. So first, psychological drug dependence: it is the state characterized by emotional or mental desire to continue taking a drug. Physical dependence: it is a state which shows itself by intense physical disturbances in case the drug is not administered. Psychological dependence means if we will not take a tea at a particular time, then it just produce the psychological effect. We should have to take. But in physical dependence, if this drug is not administered to the patient at a particular time or at a specified period of time, then this patient feel a severe disturbances or physical disturbances, and they are craving to take a drug. Then in second point, second difference, psychological drug dependence. In psychological drug dependence, no compulsion to take a drug, but in a physical drug dependence there is a compulsion to take the drug. Third point, withdrawal symptoms not observed or very minor. In psychological drug dependence or in a drug habituation, withdrawal symptoms are very minor or not observed in some peoples. But in physical dependence, withdrawal symptoms are observed, or abstinence are observed. Their absence can be observed. In fourth point, in psychological drug dependence, no need of specific drug to treat a withdrawal symptoms. For the psychological drug dependence or drug habituation, there is no need to administer any specific drug for their treatment. But in physical drug dependence, there is a need to administer antagonist with a supportive therapy, because so many peoples are miss this drug maybe produce the emesis, so antiemetics we have to administer. Then patient may suffer from the depression, or sometimes the patient may suffer from the anxiety, so we have to administer the anxiolytics, like that. Then in physical drug dependence, fifth difference, it is not necessary to develop a tolerance or physical dependence. So these drugs means those drugs which are produce the psychological dependence, drug dependence, these are not develop a tolerance, means there is no uh, property to increase the doses, but in those drugs which are produce the physical dependence, these are produce the withdrawal symptoms and threatening and very severe symptoms they are produced. And examples for the psychological drug dependence are such as the nicotine, tobacco, those people who are chewing a tobacco, that are produce the psychological drug dependence, or we can say the drug habituation. Then caffeine, so many people have the habit of taking a tea or the coffee early in the morning, without that their day will not start. Then the example for the physical drug dependence are like opiates, alcohol, then fentanyl, etc. See, the same difference, but just the heading is changed. Drug addiction is also called as physical drug dependence, and drug habituation is also called as psychological drug dependence. So the points are same, just you have to change the heading whatever the ask in the paper. Then abuse of alcohol. Acute alcoholism, the enzyme alcohol dehydrogenase is responsible for the metabolism of alcohol. It metabolizes about 10 mg pure ethanol per hour. The feature of acute alcoholism depend on the blood level. Then chronic alcoholism, it results in a development of tolerance and then physical dependence. The withdrawal of alcohol results in tremor, fits, anxiety, insomnia, confusion, gastrointestinal disturbances like a chronic gastritis, peptic ulcer, hepatitis, cirrhosis, pancreatitis, that type of various severe effects are results due to the chronic alcoholism. The termination of alcohol can lead to fever, tremors, tachycardia, agitation, sweating, hallucination, convulsions, etc. It also results in the myopathy, bone marrow depression, or the gut. Medical complications. If means the abuse alcohol results in a syndrome like decrease in appetite, then gastric disturbances, hepatic complications, liver failure maybe takes place, hypoglycemia, convulsions, cancer, skin problem, alcohol dementia, such as loss of muscle coordination. People are not able to stand properly, abnormal eye movement, inability to form a new memories, confusion, memory loss, confabulation, double vision, hallucination, that type of various effects are produced in the alcohol abuse peoples. Withdrawal symptoms. The symptoms start after about 6 to 8 hours. The symptoms start after about 6 to 8 hours and stopping the dose of alcohol ranging from hangover to the delirium. After 6 to 8 hours, headache, sweating, insomnia can be caused to the patient, and after 2 to 3 days, seizures or hallucination may be produced in the patient. And for the treatment of these alcohol abuse peoples, we have to administer the sedatives like a diazepam to produce or to induce the sleep. Then disulfiram in a dose of 0.5 gram per day, supplemented with the haloperidol 2 to 4 milligram every 4 to 6 hours. High dose of vitamin B complex, chlormethiazole, sedative, anxiolytic and anticonvulsants. These drugs we have to use for their treatment. Complications from alcohol dependence. So dear friends, so say no to